Great.
Welcome to the Path Monk Presents podcast. Today, I am super excited to have our guest on the show. She is from playithealth.com, Kimberly Gandy. Kim, how you doing?
Great, Sean. Thanks for having us. We appreciate it.
I could probably spin my wheels here and tell you about what I thought coming across your website, but why don't you just give us a view from 30,000 feet? What do you guys do
Okay,
there?
sure. Yeah, so we're a digital health company providing a complete virtual care experience, and we're designed to be integrated into a host of practice environments. And specifically, we provide remote patient monitoring and a platform that is rich in communication and incentives, resulting in a really high engagement and adherence rate.
Great. So would this be, obviously this is for anybody, your clientele would look like anybody that needs any sort of medical care. Basically anybody walking around in the United States would love and need to hear about what you guys are doing there.
We would hope so. So as you can imagine, there are different market segments that we focus on from time to time because that's just, part of our overall, way that one has to operate. But yes, the solution was designed and indeed intended to be used across the spectrum of diversity of the patient populations that we all encounter.
Great. So even just, obviously we're tech guys here. So if we're looking at your website, thinking about your website, what role does your website play in client acquisition?
So it varies. We right now tend to drive most of our clients to our websites, both for initially signing up for those demos and for getting more understanding of our products. But we do get we get a lot of clients also from referrals. In other words,
Okay.
from groups that are already sort of using the solution. But even when we have those, we oftentimes have them start on our website to figure out, hey, exactly where do you want to go?
Yeah. Obviously digital age. We were talking about that before the show. Just everybody has to adapt and learn and do new things. I think it's amazing what you guys are doing that you're able to offer health for people even now, thinking of COVID, right? People can't actually go to or they're suggested not to go to the doctor straight away. I know people that work in hospitals and they're saying, here in Germany, they're saying that the hospitals are totally booked up. So I think it's obviously, it's great to change with the times, and it seems like what you guys are doing is definitely needed. And it's such a moment that we're in that we would need those things.
Yeah.
The strength of your website, what would you say is probably the main strength of it? Would it be
Um,
you're able to actually say you convince the people that are looking, thinking, you know what, I've heard about this, I'm just going to look. Is it kind of content? What would you probably say is the strength of your website?
Yeah, so I think the strength of our website would be to project the variety of different services that we offer and sort of to give people an overall view. And then, yes, to guide them to some of the content that we're generating. And in all honesty, that is something that we've been emphasizing even more within the last 3 months, just because it is so necessary. So we're finding ourselves in this position where we're a digital health company with a remote patient monitoring solution that could offer so much to patients in the marketplace right now, and cloaked in a company with expertise from basic science through technological implementation to clinical implementation. So we feel like we have a lot to offer in
Mhm.
the content space, and we're really starting to push that out a lot more right now.
And if you were to put your critical hat on, right, you're head of the company, you're leading this thing, when you look at the website, what would be some things where you think, you know what, if we improved this would make a really big difference in what we're doing?
Yeah, I think if we improved sort of ease of use, to
Yeah.
be able to go from, hey, I like it, to this is when I want a demo, and making it very transparent to clinicians that they can set this up at their own schedule, in a way that's convenient for them and short.
Yeah.
And we have that, but I'm just not sure 100% how clear that is to the clinicians that, hey, I can get a demo in 5 minutes, I can get it in 15, or I can get it in 30, right? Because
Right.
that literally is sort of the variety of time windows that clinicians are thinking about when they do these things.
Yeah. And so if this is an area you're already thinking about, what are you taking any practical steps to improve, to grow?
Yeah, we are. And so we are, hiring consultants in the social media space. So I we are fortunate enough to have what I consider a gem in the whole content space. An individual named Mary Topping. She's our director of marketing content, and such a unique series of talents that she has. So she is not only is she an MBA from a various prestigious institution, but she worked at Kaiser for a long time. She is a great writer, and it happens to be that her passion is reaching out to patients and making healthcare understandable.
Cool.
So for a group such as ourselves, you kind of
Yeah.
couldn't, find somebody who matches our sort of vision better. And so uh, we're sort of trying to get her to focus mainly just on generating content, but we're trying to find people that can help us. Okay, how do we really get that to the people that need to hear this the most? And
Yeah.
so we're kind of going step by step, diving out with sort of consultation, and then sort of eventually, as we sort of scale, hoping to bring somebody on to sort of handle a lot of that for us.
Great. Yeah. Obviously being able to straddle that fine line between obviously writing content or connecting with people on a personal level, but saying it in
Right.
a way that you can connect to a large audience is not everyone can do that. So it's
Yeah.
amazing. So we're going to come back to your product for a second. What would you say for the people listening? Like, what is the main competitive advantage, or is there competition? I'm thinking, I lived in the States, obviously. Um, yeah. What would you say is the competitive advantage, or how does the market look for what you guys are doing?
So it is if you just looked at the remote patient monitoring space, that's a very busy space right now,
Okay.
using sort of the colloquialisms that we use in the space. And that's because 3 years ago, Medicare announced that they would pay for remote patient monitoring. So as you can imagine, the market then flooded with groups that were going strictly after remote patient monitoring. Our competitive advantage is that we had that as part of our solution, um, 7 or 8 years ago. So we
Okay.
identified 7 or 8 years ago that it would be hugely advantageous to patients to be able to monitor biometrics in their homes. So if
Okay.
you think about the fact that we started off with transplant patients, there were already plenty of reasons for us to try to monitor those patients at home rather than bringing them into a clinic every time they had a problem, right?
Yeah.
And so we were already primed with that use case way back when. So we built that into our system. So when this came to the point where, okay, now Medicare is going to pay for remote patient monitoring, we have remote patient monitoring embedded in a very rich communication and incentive platform so that we have high levels of engagement. So every single time that a patient engages with our platform, whether it's with RPM or with the other components, we couple that with points that can then be coupled with incentives. And as a result, we have some of the highest, if not the highest, levels of engagement on the market.
Amazing. Great. And so we've been a little bit kind of in an aerial view, like just thinking more structurally, right? I know the tension that obviously a company can have working with different companies and sales. Um, how is your sales and marketing team at the moment structured?
So we have just hired a senior VP of sales. And so he has come in from a very strong and long history in sales and launching very significant and successful sales components. We obviously couple his efforts and vision very closely with Mary's to make sure that
Okay.
we are, having some concordance of that vision and what we project. We do also involve our clinical team very significantly in that sales process. And that is one of our significant offerings, is that we come to these groups and say, hey, we know this is scary. We know this is a very difficult time for a lot of groups to start something new, but literally this is what it can do for you if you
Yeah.
start it. And this is how we can help you. Right. So that's how, so having that sort of clinical team sort of ready to help not only escort them through how they would implement it, But then we actually have a clinical team that can even stand up some of those services for them
Hmm.
as they are onboarding. So we have a partner clinical team called Remote Care Docs that literally can either do the remote patient monitoring for the practice or can help them on board and then just step away as they become more comfortable.
Wow. Awesome. So thinking about people using your website, and if they come to your website, they decide, okay, you know what, I'm going to sign up. Um, what does that look like internally? Does your salesman just jump on the phone with them? It says you have even the client, right? You got to talk to the clinical team. I mean, I'm assuming that there's a whole diagnosis process. Like, what kind of, from a sales standpoint, what does the structure look like there?
Yeah, that's a great question, and it is evolving. But to date, what happens is that if they go to the website, they can submit a request for a demo, right? So they can request a demo, they can request a meeting. They get a choice of what they would like to request,
Okay.
and then we follow up with, hey, you can either pick a time for a demo or you can schedule it on this link, right? Because everybody has different tastes now, right?
Yeah.
And
Yeah.
for the most part, we like to do the demos via a video conference, right? So we can escort people, we can show them everything. We'll do whatever they're comfortable with, but that is our preference, that we start to do the demos by these video conferences. And since, these clients are all over the country, that kind of works out well. And we can usually turn those around within 48 hours, right? Depending on sort of what our schedule is, since the demos can be 15 to 30 minutes. We get back to them within 24 hours, and we can usually turn a demo around by some member of our team within 48 hours.
Awesome. Yeah. So now we're just going to change gears here a little bit. We're going to talk about you as a leader, leading a company. Probably there's got to be a way that you continue to grow. And yeah, what content do you consume? How do you educate yourself, grow as a person, as a professional, leading a company? Why don't you just touch on that for a second?
Yeah, so the issues about how you grow as the leader of the company, uh, that really changes, and I reach out to different resources for that at various different points in time. And the beauty of it is that there are a lot of those different resources, and you just find yourself needing different resources at different points in time. Um, so we have been very fortunate to be a part of basically 5 different accelerator organizations over time. And we have found that we have gained tremendous amount from all of them that we've been involved in, and that each one of them has had the ability to put us in touch with different organizations, different people, and different things to really foster our development. Uh, for instance, there is a group that's local. It's called Pipeline Entrepreneurs. When I say local, it involves 3 states. So they pick a
Okay.
certain number of entrepreneurs each year. Um, that one is not specifically health focused, but helps us sort of understand more sort of business processes and people that we can talk to, and all those elements of sort of corporate management, et cetera. Um, there are, 3 others that we have been involved with: Village Capital, Startup Health, and Springboard Health Enterprises, and entrepreneurial program. And those are all very highly developed, programs with a lot of deep reach into the space that we're able to really get a lot of input and guidance from. And like for right now, I'm sitting on, a session every week with Startup Health where they bring in sort of leaders in the industry, and it just keeps you up to date, even if you're slap dab in the middle of the country. So
Great. Okay, since we're slowly coming to the end, this is the part of the show that a lot of people really love. This is our rapid fire session. I don't know if you know about it, but it's just basically where I start asking questions about you or about what the company, and you just answer them as quickly as possible.
okay,
Ready
all
for
right,
it? Okay.
yeah.
Let's start with my favorite question. What is the last book you read?
Oh, that's a great question. Um, it would have to be Rachel Maddow's, her next to the last book that she put out, and I can't come up with the title of it right away.
What's the one thing that your company's focused on at the moment?
Um, Figuring out the best way to guarantee continuity of care in COVID.
if you could start your company over from day one, what would be the advice that you give yourself?
Stay true to your missions and believe in your strengths and reach out to those that uh, have expertise in areas that you think are complementary.
Great. And so we normally give our guests the last word on the show. If there's anything that you want to say, but or if you want to, you can just sum up what you guys are doing there and why people should check it out.
Well, I think I'll start by saying thank you for giving us the opportunity to speak with you today. And I guess my biggest message is going to be to everybody to that we are probably going to have several, if not many more months where we're going to have difficulty in healthcare.
Hmm.
But there are pathways to move through these problems. And I think we are all seeing areas where we're defining better ways to work together. And I think that is critical for us all moving through this. And we will get through COVID-19, and we will use the things that we have learned in COVID-19 to make sure that we're better able to administer care to everybody on the other side.
Great. That was Kimberly Gandy at playithealth.com. Kim, it was a great time. Thanks.
Yeah, thank you so much for doing this. We really appreciate it.